Firstly, it's the help when the point of wounding, the skills of the merit team that will pick them up from the field and take them into Bastion, the advances in surgery and resuscitation in Bastion itself, and the whole chain of care makes a big difference. But behind all this, obviously, is the individual. And here you have usually a fit individual, a young person, usually well motivated, with a tremendous determination to make the most of it. And I'd have to say that in the last decade, I've not had one soldier complain about being injured. They accept that was a risk, it's happened, now they have to get on with life, and that is, you know, I applaud that very much. Integral to all this, of course, is the high standard of rehabilitation we have from Headley Court, and up front, the Headley Court consultants are here every Tuesday, and they'll see patients soon after their arrival. So if you're a member, if you're a family member and your son has been injured very recently, perhaps he could still be in intensive care, the Headley Court consultants will be able to give some idea of the rehabilitation timings. So I could say that, you know, in 2 months' time we'd anticipate your son will be at Headley Court. So straight away there is light at the end of the tunnel for the family. There
must have been advances in the way that you perform surgery, though, to allow these guys to survive.
Oh yes, and particularly in relation to blast, and blast, the blast wave, the contamination associated with that produces devastating wounds, and we have actually redefined the textbooks on how one should manage that sort of type of injury.
What do you think is going to be the legacy of Iraq and Afghanistan?
So in relation to the surgical perspective, yes, you know, we've learnt about what's called damage control surgery, and that is doing the least possible to keep a severely injured patient alive. And historically in surgery one used to do everything in a single sitting in the operating theatre, and our patients quite frequently didn't survive. So there are some very clear take-home messages from this war, and it's very important that these are remembered and indeed are translated into civilian practice.
Are there particular patients that you have treated over the past few years that really stand out, that have been particularly difficult?
We have some very, very challenging cases and problems that you will not find in a textbook nor in any aspect of research, and we've had to look at bespoke solutions for some of these problems.
Have you got any examples that you can share with us?
Yes, I mean patients who've lost, for example, the whole of the abdominal wall, so the front of their tummy, or they've lost major components of the pelvis. You can quantitate injuries on an injury severity score. It's quite a complex formula, which is determined post-injury, but you can get a score from 0 to 75. Anything over 15 is recognised as major trauma and life-threatening trauma. And I guess in the average intensive care unit, civilian intensive care unit, you're going to see patients, the worst case scenario, injury severity score perhaps up to 40. And we're actually seeing now patients surviving with injury severity scores right at the top end, 60 to 75, and indeed some who are 75. So we have a significant number of unexpected survivors, and that truly is a reflection of the whole chain of care, of which we are clearly an important part here, but we are only a part of that care.